You can come in.
Hello, how are you today?
Doing well.
Good, thank you. My name's Ashley Burgess. I'm a family nurse practitioner student here in the office.
Okay.
I'm going to go over your health history today, if that's all right with you.
Yeah.
Great, thank you, Mr. Burgess. Is it okay if I call you Mr. Burgess?
No problem.
All right. Well, what brings you into the office today?
Oh, just, yearly exam.
Yearly exam?
Mm-hmm.
All right, great. Well, are there any concerns that you have, or is anything that you would like to address during this yearly exam?
No.
No. All right, perfect. Well, I'm going to just kind of let you know what's going to happen, and that way you're aware of how the interview will work.
Okay.
Okay, great. And to start, I just want to let you know that everything we discuss here is going to be kept confidential between the two of us.
Good. All right.
Good.
Good.
And so what I'll do is I'm going to ask you a slew of questions about your health, your family history, your social circumstances, just so we can get a good idea of your entire health history.
Okay.
It'll take about 20 minutes or so.
Awesome.
Great. And if you have any questions throughout, please let me know.
Will do.
Great. So we established your name is Evan Burgess.
Yes.
Okay. And what's your date of birth?
11/2/87.
Perfect. And you are here just for your yearly exam.
I am.
Don't have any major health concerns that we'd like to discuss today.
No, not today.
I see you brought in your medication list and your allergies and immunizations.
Yes.
Thank you so much.
Yeah?
I'm just going to review them if that's all right.
Yeah. Sure.
Great. So it says here that you only have seasonal allergies.
Right.
Can you tell me about those?
They show up seasonally.
Okay. Perfect.
No, just, this time of year, spring, summer, just get usual conditions, congestion, things like that. But, I take Claritin, and it seems to resolve those issues.
Okay.
Yes.
Perfect. And so when you said you take Claritin, I see you wrote down Claritin D 24 hour.
Mm-hmm.
Is that correct?
Yes.
How do you take that?
As needed. If I feel like I'm good, I don't take it. But if I don't take it.
And do you take that year round?
No, like I said, just kind of as needed. Yeah.
What are your seasonal allergies? What seasons are they worst?
Like spring, summer. Other than that, I don't really notice any other issues in those months.
Perfect. And any other medications, like non-prescription, vitamins, supplements, any borrowed medications? No? Okay. And I see that you have immunizations. You had a flu vaccine and a Tdap last year.
Yeah, sure did.
Okay. And any other vaccinations?
There's that, that list they make you do before you go to college. I had to do all those. What they are, I'm not sure, but.
Okay. And do you recall what year that was?
2006.
2006?
7.
Perfect. And thank you so much for that information. Now I'm going to move into your past medical history now.
Okay.
So I'm going to list some conditions, and if you've ever had them, just let me know.
Okay.
Have you ever had anemia, arthritis,
Mm-mm.
asthma, or any lung problems?
No.
Any cancer?
No.
Childhood diseases like measles, mumps,
Mm-mm.
rubella,
No.
scarlet fever,
Nope.
rheumatic fever,
No.
chickenpox?
Yes, that chicken.
Do you know when that was?
Honestly, no.
Nope.
Sorry.
Any Crohn's disease?
No.
Heart problems? Depression?
Mm-mm.
Psychiatric history? Diabetes?
No.
GERD or reflux?
No.
Any high cholesterol?
Mm-mm.
Hepatitis? HIV or AIDS? Any high blood pressure?
Mm-mm.
Kidney disease?
Mm-mm.
Bronchitis or pneumonia?
Mm-mm.
Tuberculosis?
No.
Seizures?
Mm-mm.
Thyroid disease? Stroke? Any other conditions that I may have missed?
No.
No.
So,
So you've only had chickenpox and just those seasonal allergies.
right.
All right. Have you ever been in the hospital? No? Have you had any screening tests done?
Yeah, I think, EKG?
An EKG?
Right.
Okay. Did you have that for a particular reason or
No, it's just a screening test.
just a screening? Okay, when was that?
I want to say last year.
Last year?
Yeah.
Was that at your annual exam again? Yeah.
Yeah, I think it was. If I
Okay.
recall correctly.
And do you know what the results of that were?
Must have been fun because I didn't say anything or correct anything. So.
Okay, perfect. And have you ever had any surgery?
No.
No surgeries?
Nope.
All right. Well, if it's okay with you, I'm going to move on to your family history.
Okay, that's fine. Yeah.
Perfect. And so I'm going to list the same types of conditions that I just previously listed for you, but now about your family.
Okay.
Okay.
All right.
Does anyone in your family have any cancers?
Oh, my mother.
Your mother?
Yes.
What did she have?
She had thyroid cancer and breast cancer.
Okay, and is she still alive?
Yes, she is.
How old is she?
59?
59?
Yeah.
Okay, and does she still have those cancers?
No.
No?
No.
Do you know when they were?
10 years ago, maybe more. I was young, so I don't recall the details exactly, but she's been good for a while. So.
Good, I'm glad to hear that. Okay. And any high blood pressure in your family?
No.
No. Coronary artery disease? High cholesterol?
No.
Strokes?
No.
Diabetes? Thyroid disease?
Mm-mm.
Renal disease?
Nope.
Arthritis? Tuberculosis? Asthma or lung disease?
Uh-uh.
Headaches or migraines?
No.
Seizure disorder?
Mm-hmm.
Mental illness? Suicides?
Mm-hmm.
Substance abuse?
Nope.
Any major allergies?
I don't think so, no.
Any genetically transmitted diseases?
No.
Okay. Any other major family history that I might have missed?
I think you got it all.
And so we'd established your mom is alive and she had breast and thyroid cancer in remission.
Mm-hmm.
How about your dad? How old is he?
59.
59?
Yes.
And anything that you can think of with him?
No.
No.
Pretty healthy guy.
And do you have any siblings?
Yeah.
Tell me
Older
about
brother, younger brother. One's about 33. Younger one's 25.
Okay. And any health history with them?
No. Pretty healthy people.
Pretty healthy? Good. And do you have any kids?
Yeah, I do.
You do?
Yeah.
Tell me about them.
I got one little boy. And pretty healthy. You know.
How old is he?
He's 1 year in July.
Congratulations.
Yeah.
That's wonderful.
Mhm.
What's his name?
Evan Michael Burgess Jr.
That's awesome. I love that. Juniors are great
Oh,
names.
yeah. Oh, yeah.
And so, are you married?
Mm-hmm.
You are? How old's your wife?
She's 26.
26?
Mhm.
Okay. And any health issues with her?
Mhm.
Oh, great. Okay, so it looks like we established your family history. I'm going to go ahead and move on to your personal and social history. Is
Okay.
that all right?
Yeah, that's fine.
Okay. And are you still comfortable? Is
Oh,
there anything
yeah.
I can get
Tell
you?
what. Great chair here.
Perfect.
Very comfortable.
So, do you drink any alcohol?
Socially.
Socially?
Yeah.
Okay, and what do you drink socially?
Ice cold brew.
Okay, so just some beer.
Yeah.
Anything else? And any more than just the occasional social outings?
Nah.
Okay. How about tobacco use?
Not tobacco use.
No.
I've seen those commercials and I'm staying away from that stuff.
I'm glad they're working.
Yeah.
And have you ever been a smoker?
No.
No? Good.
Uh-uh.
And how about any illicit drug use? No? Never tried any drugs?
Mm-mm.
Good. And now I'm going to ask about your home environment.
Go.
Do you have guns in the home?
Sure do.
Do you keep them locked up?
Oh, best I can, yeah.
Okay, perfect. And do you have smoke detectors in the home?
Oh, gosh. Too many.
Too many.
They drive me crazy.
Well, that's good. So you seem to test them?
Yeah, unintentionally all the time.
Okay, Perfect. So they are working. And I'm going to guess since they work too well, you must have a fire extinguisher in the house?
Well, yeah.
Okay, perfect. And now when you're in the car, do you wear your seatbelt?
Yeah. Oh, yeah. Seatbelts save lives.
They do. Good. I'm glad to hear that. What do you do for a living?
I'm in construction management.
Construction management.
Yeah.
Okay. Tell me about that.
I'll just do some inspection, quality control, those types of things. Make sure people are doing what they're supposed to be doing. It's generally it.
Do you like it?
Oh, yeah. Yep. Gets me
Great.
outside, so it's nice.
Very good. And what do you do for physical fitness?
I work out here, there. Plus, do some stuff in the yard. I stay pretty active. I try to.
Good. And how about your diet?
Overall, pretty good. There's times I could eat better, but most of the time I eat pretty clean.
You're pretty clean?
Yeah.
Good. Very good. And how many times a day would you say you eat?
3, 4, usual breakfast, lunch, dinner. Yeah.
And where were you born and raised?
Born in Columbus. Moved up to the Akron area around 2nd grade. Been here ever since.
Okay, great. So you're in Akron or?
Green, suburb of Akron.
Okay,
Yeah.
perfect. And you currently live in Green as well?
Do. Yep,
Do you
sure
own
do.
your own home?
I do.
Great. And you had told me you're married and you have one son?
I do.
That's wonderful.
Mm-hmm.
And it looks like I have a pretty good idea of your personal and social background.
Okay.
So I just have one last thing. It's called a systems review. And so I'm just going to kind of ask you about each of your body systems and
Okay.
make sure we haven't missed anything.
Right, sounds good.
Perfect. Thank you.
Mhm.
Generally, have you had any unexpected recent weight gain or weight loss?
No.
No? Okay. Any fatigue, weakness, fevers, night sweats?
Nothing like that, no.
Any with your skin? Any changes, rashes, redness? No? Any hair loss?
I don't think so. How's it look?
Looks pretty good. I would say no hair loss.
Okay. Sounds good to me.
Good. And any headaches, dizziness, or head injuries?
No.
No?
Nope.
Okay. And any changes in your vision recently? Any pain, redness, dry, itchy eyes?
Not really, other than, the allergy-related items.
Just the allergy-related items?
Yeah, that's about it.
Okay. And is that something that bothers you further than when you take your Claritin D, or?
No. Claritin D pretty much knocks those out. Just
Okay. So you just have those dry, itchy red eyes
Mm-hmm.
when your allergies are bothering
Right.
you?
All the time.
Okay. And do you wear glasses or contacts?
No.
No? Have you had a recent eye exam?
Recently, no.
No? Do you know when your last one was?
She's 7th grade, I think.
7th grade?
Been a while.
And since you haven't had one, do you feel that your eyes are okay and pretty good?
Yeah, for the most. Yeah, that's it.
Good. Glad to hear that. How about with your ears? Any hearing changes, earaches, any drainage, ear infections?
No.
Any, I know you have the sinus problems. Otherwise, any runny noses, frequent colds, nosebleeds?
No, beyond allergies, no.
How about any frequent sore throats, hoarseness, difficulty swallowing?
Mm-mm.
Any bleeding gums?
No.
Do you see the dentist regularly?
Yes, I do.
When was your last exam?
Well, about 6 months ago. The funny thing is I actually have an appointment today.
Do you really?
Yeah.
Perfect. Glad to hear you're staying up on your dental
Oh, yeah.
exams.
Knocked them all out in one day.
Perfect. And with your neck, any lumps, swollen glands, goiter,
Mm-mm.
pain, stiff neck?
No.
Okay, great. With your heart and your lungs and your breathing, any coughs, coughing up blood, shortness of breath,
No, nothing like that.
wheezing,
Mm-mm.
chest pain, any heart palpitations or been told you have a heart murmur?
No.
How about having to use a lot of pillows to sleep at night? It's called orthopnea.
No.
Any edema or swelling in any of your extremities? Like your hands and feet?
No, nothing like that. No.
Any leg cramps, blood clots, trouble with your circulation?
Mm-mm.
How about with your belly? Any appetite changes, difficulty getting full very fast? Any heartburn, nausea, vomiting,
No, nothing.
stomach pain, constipation or diarrhea, black or bloody stools,
Mm-mm.
irregular bowel
No,
movements?
that's pretty good answer.
How about with your urination? Any frequency, any painful urination, urgency, incontinence, going a lot at night,
No.
any flank or side pain?
No.
Ever had kidney stones?
No, hope I don't.
Good. And while we're talking about down there, any hernias?
Mm-mm.
Any discharge or sores?
No.
Ever had any STDs?
No.
Sexual dysfunction?
Mm-mm.
Then with your muscles and your joints, any muscle pain, joint pain, low back pain? Ever had broken bones?
No.
Perfect. You are staying very healthy. With your mood or your attention span, any changes? Any changes in your speech?
No.
Any fainting or changes in your orientation, judgment, not knowing where you are?
Mm-mm.
How about any anxiety or memory loss?
No.
Any irritability?
No. No.
Any feeling down or feeling useless?
Mm-mm.
Any suicide ideations or attempts?
No.
Any easy bruising or bleeding? Ever had a blood transfusion?
No.
Any heat or cold intolerance?
No.
Any excessive thirst, urination? Any excessive sweating?
No, we're all pretty good. That's
Any thyroid troubles?
No.
Any gallbladder problems?
Mm-mm.
Any liver problems or jaundice?
No.
No? Is there anything that you can think of that we might have missed?
I'd say your piece of paper there covered it all.
Wonderful. Well, I'm glad we covered everything. And I just would like to summarize, make sure that we didn't miss anything.
Yeah, no problem.
Great. Thank you so much. And so it seems that you are overall a generally healthy male. You really just have seasonal allergies, and that Claritin D helps quite a bit. Your only medical history, I think, is chicken pox. And you don't really drink much. You get your exercise in. You try to eat a pretty healthy diet. And I think we have everything covered. Do you have any questions for me?
No.
No? All right, well, if you think of any, please don't hesitate to give us a call. And I just want to thank you so much for your time today.
Well, thank you.
Thank you. You have a wonderful day.
You too, thanks.
Thank you.